This is Health 54, the program that lets you in on health-related issues across the 54 African countries and the globe, right here at your digital-first Pan-African News Network, TOS Television. I am Rose Audu. It looks like science has finally triumphed in Nigeria, as the health sector has continuously witnessed successes even amidst challenges bedeviling the sector in the country. It was a moment of joy and celebration at the University College Hospital Ibadan Wednesday as a team of healthcare professionals delivered a set of triplets belonging to Omokainde Osiki at about 2 p.m. local time. The babies of females weighed 1.4 kilogram, 2.5 kilogram and 2.4 kilogram respectively. They are the first set of children to be delivered from the in vitro fertilization in the hospital. Consultant gynecologist and lead surgeon Sheun Saunu described the delivery process, which lasted for about 45 minutes, as a success story. Chile's health regulator on Wednesday approved emergency use of the COVID-19 vaccine developed by Chinese company CanSino, as the South American country forges ahead with a massive vaccination campaign and fights a second spike of cases. Chile hosted a late-stage trial for the CanSino vaccine, and President Sebastián Piñera said at the end of March that he had signed a deal to buy 1.8 million vials of the single-dose vaccine. The vaccine, which has received similar approval in China, Mexico, Pakistan, and Hungary, is due to arrive in May and June, the presidency said, and could help inculcate the country's more rural populations, since it only requires one injection. Also, as Nigeria joins the world to commemorate the 2021 World Health Day, the World Health Organization has urged countries to build a fairer, healthier world post-COVID-19. This was contained in a message by the WHO Director General Tedros Ghebreyesus, released for the 2021 World Health Day. Ghebreyesus said, and I quote, "Following the effect of COVID-19 on the health system of countries around the world, the WHO is therefore issuing calls for urgent action to improve health for all people." End of quote. And the Nigeria Center for Disease Control and CDC said that Kano, Plateau, Bauchi, Gombe, Nasarawa, Kaduna, and the Niger states have reported confirmed human cases of avian influenza, H5N1, also called bird flu. The NCDC Director General Chikwe Ihekwezu made this known in an interview on Tuesday in Abuja. This is TOS Television Network, and you're watching Health 54. Welcome back. You're watching Health 54 on TOS Television Network. Hospitals are overcrowded and people are facing death, and health system in Brazil is experiencing large number of patients. The country has recorded more than 4,000 COVID-related deaths in 24 hours for the first time. The total number of deaths is near which is close to the number in the US. In spite of this, Brazilian President Jair Bolsonaro has stood his ground to oppose lockdown measures in the country. Bolsonaro is of the opinion that the damage of lockdown to the economy will be worse than the effects of the virus itself. And in Uganda, Down syndrome is one of those rare medical conditions, and it's not surprising that it's given minimal awareness, even though there is a projected rise in the number of children being born with the genetic malformation. Daniel Tomiwine, a pediatrician at the Children's Clinic in Naldia in Kampala, says the lack of awareness of the condition starts at birth. He says health workers have not been formally trained to identify Down syndrome, and affected newborns are subsequently not diagnosed until childhood. About a third of COVID-19 survivors experience long-term brain or psychiatric disorders, a study published in Lancet Psychiatry recently reviewed. Looking specifically at 14 neurological and mental health conditions, researchers analyzed more than 236,000 patients who were diagnosed with the virus over a 6-month period and found that 34% of them also had a neurological or psychiatric diagnosis. For 13% of those patients, it was their first recorded neurological or mental health diagnosis. And furthermore, survivors were at the highest risk of experiencing anxiety at 17% or mood disorders at 14%. The scientists said there were also risks of experiencing substance use disorder, insomnia, dementia, or stroke, though those dangers were considerably lower. You're still watching Health 54 on TOS Television Network. We will be right back. Welcome back. It is a TOS Television Network and you're still watching Health 54. Nigeria on Wednesday reported 110 new COVID-19 cases in 11 states. Also, no new death was recorded from the virus for the 6th consecutive day across the country. This is according to an update published by the Nigeria Center for Disease Control Wednesday night. With no deaths in the past 6 days, the fatality toll in the country has remained 2,058 in total. The National Association of Resident Doctors has vowed to continue its nationwide strike that has prevented access to healthcare across hospitals. The resident doctors embarked on strike on April 1 to protest issues that mostly border on poor remuneration and conditions of service. Among their demands is a 50% increase of the 5,000 naira they are being paid as hazard allowance. And on Ebola, the Ebola virus disease outbreak in Guinea was declared on February 14, and as of today, a cumulative 23 cases of Ebola virus disease had been notified, including 16 confirmed and 7 probable cases. 2 people, 1 confirmed and 1 suspected cases, are currently hospitalized at the Ebola Treatment Center of Nzerekore. For the first time since 2016, cases of hemorrhagic fever caused by the virus have been recorded in the country of Nzerekore, located in the southeast part of the country, leading to several deaths. The first victim, identified in the sub-county of Goke, was a nurse who died at the end of January of 2021. All other cases are from people who attended the funeral on February 1, 2021. And COVID-19 cases and hospitalizations are up nationally, but deaths are going down. That could be because younger people now make up a majority of the cases and more of the older population has been vaccinated. The recent holidays impacted more than just our social calendars. We have seen a slight upward curve recently, and we're trying to suppress that as much as we can, said Joseph Pepe, administrator for the Florida Department of Health in Charlotte County. Pepe said coronavirus cases in Charlotte County are rising, with similar trends happening across the state. That is Health 54 right here on your digital-first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com and do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Also remember, health is wealth. My name is Rose Audu. Till I come your way again, remember to stay healthy. Thanks for watching.